During an emergency, the timely resolution of the most life-threatening cause is paramount, and choking is certainly one of these instances. Hence, the damage caused by the use of aggressive and forceful compressions, thrusts and back blows warrant the collateral injury or damage from these interventions and can be considered irrelevant if the person dies. It is better to prevent death even if injury has occurred, as the injury is treatable but death is irreversible. Since its inception in 1975, thousands of lives have been saved by the use of abdominal thrusts. The one thing that becomes apparent after a review of the reports is the number of injuries and trauma caused by choking emergency treatment. Properly performing abdominal thrusts has a direct effect on the incidence and severity of collateral trauma. Damage often occurs due to the level of treatment needed. Multiple research groups have done a good job of reviewing the topic of abdominal thrusts, post-abdominal thrusts, or any choking emergency treatment performed. Further medical evaluation must occur immediately to ensure that there are no collateral trauma or injuries. This applies especially to those over 65, as most injuries occurred in this demographic. While complications are typically low, one injury that does occur is a gastric or stomach rupture, which has been cited as one of the most common injuries sustained after abdominal thrust procedure, and it has a high mortality rate. Contributing factors include individuals being over 65 years of age or the ingestion of large amounts of food and alcohol. A case study of 2 individuals experiencing gastric rupture stressed that the improper application and over-application of the abdominal thrust was a significant factor in causing the rupture. Another injury caused by choking treatment is a lacerated liver and a large subscapular hematoma draining into the pelvis. Reports have shown this to be the result of multiple abdominal thrusts, often which failed to dislodge the obstruction in the airway. Another case study found that the first responder must also show care when performing abdominal thrusts, as one emergency caregiver reported a rotator cuff tear while rendering aid. Finally, chest thrusts were examined in 323 children who died after receiving CPR, of which 80% were performed in hospital and 44% of them had fractures of their ribs and 21% were bilateral. As we perform chest thrusts with choking, similar results could occur.